been treated or been to Dr. Frank Hayward, Heartland Spine, here in Cape Girardeau. And of course, they got an office over in Marion. But we've asked Miss Norma to come on the air and talk to us about the treatment that she got down there. So we have her permission to do that. So I'm going to bring her on. Miss Norma, you there?
Yes,
How are you doing today?
real good.
You get past this snow, I reckon.
Yes.
Well, good.
Don't like it, but can't do anything about it.
That's right. Well, we might get some more. According to the Weather Bureau, they say we might have a little bit more of this.
Yes, this weekend, I think I heard on the news.
I hope we just don't. I just hope we don't lose our power this year.
Yeah,
Yeah.
me too.
Now, you've been to Dr. Frank Hayward at Heartland Spine.
Yes.
Let me ask you, what was your problem? Were you having pain in your spine and your back?
Well, I have degenerative disc disease, and it was going to my legs, and I was having a lot of pain in my legs. And I had been to a few doctors for other treatments, and they had told me surgery wouldn't help. So I was referred to Dr. Hayward, and he suggested a procedure called the X-Stop, and it's a titanium implant, and it's put on the vertebrae, and it's not very large incision, and it stopped the pain in my legs, and I'm really happy. I can walk a lot better. I was resorting to a wheelchair.
Oh, goodness.
For shopping, and now I can use, I can walk and push the cart and no pain. So I'm really happy.
That is great. How quickly after you had that procedure done did you find relief?
Well, I was in the house for several days, but I guess I would say I walked out of the hospital.
Without a wheelchair?
Without a wheelchair. And then I stopped to get something to eat on the way home.
Goodness.
Now, I live in Illinois, so that's the first time I've ever had something to eat after surgery.
That is great.
And no pain. The surgery was painless. The best surgery I believe I've ever had. And I'm just very happy because I was getting to the point that I thought that the wheelchair was the only answer. So I'm really, really happy with the procedure that I had.
Have you recommended him to other people?
Yes, I'm telling everybody.
Well,
and some ladies, one lady called the other day, and she's got quite a bit of trouble. Not quite like mine, but I'm giving Dr. Hayward a good recommendation because if I ever need any more surgery similar to this, I know where I'm going.
Right, because you had been to several other doctors prior to
Yes,
this.
I spent the whole year of 2009 getting different shots and steroid shots and everything. They're usually sent to most of that for help, but I was past that, and I was told that surgery wouldn't help, but it did.
So you had the epidural shots for a while, and
yes, I had steroids and epidurals, and then I saw a surgeon, another surgeon, and he didn't want to do the surgery, and so I was recommended by my family doctor to Dr. Hayward, and it's really been great, and I'm really happy because like I had repeated a while ago, that I thought that I was heading for the wheelchair, and now I'm not.
Well, congratulations to you.
Well, thank you. I'm really happy, and I think Dr. Hayward is a great doctor, and I'd recommend him to anyone.
When you first met him, what was your impression of him, the very first visit?
Well, I knew he was a sincere doctor.
Right.
And he explained the procedure, and he's well, I was comfortable with him, and he's got a great personality towards the patients.
Right.
You're comfortable from the first time you meet him.
Right.
And he is, in my opinion, he's really a great doctor.
Right. And a great person to go with it.
Yes. Yes.
Well, thank you so much for taking time to speak with us about this and share your experience and your back problems. And for people that's had back problems or is having back problems, that really affects your quality of life in a big way, doesn't it?
It sure does. Yes, it mostly takes over your life.
Right.
Because you just you're in pain and you concentrate more on the pain than you do the quality of life. So
well, it just about got you where you couldn't do anything except.
Right. Right. I was having to rely on my son to hold on to his arm, and he had to go when we went shopping. He'd had to get the wheelchair for me and bring it to the car and push me around, which he doesn't mind. But I'm independent. I wanted out of that wheelchair.
Absolutely, absolutely, and no doubt you're not taking near as much medication as you were before this surgery.
No.
Well, that's
no.
great.
Yeah, I'm really happy with everything that happened.
Well, I appreciate you taking the time to spend with us and share your experience with us, and know that you have recommended Dr. Hayward to a lot of other people.
Yes, and I will continue to do so. All they have to do is call me, and I'll give them all the information that I can, because he is really a great doctor.
Well, thank you so much. I appreciate that, and I hope he's getting to hear this conversation.
Okay.
And you take care, and God bless.
Okay, thank you very much.
Well, thank you.
Bye.
Bye-bye. That's Miss Norma Barkow, and she has been a patient of Dr. Frank Hayward at Heartland Spine. You heard her praises and what he had done for her, and this is one of many that he has helped. And I might add, he is doing my wife now, and he's fixing to do surgery on her upper spine, and he also did a procedure. I don't know what it's called, SCS or something, that was a trial basis, and you had that for, I think she had that for 4 or 5 days. It's handled by remote control. I've had some friends that's had that done. Now then, he's going to implant that in a permanent position there, and brings great relief.
Right. And, one of the other things that we'd like to pass on, sometimes as we age and we have increased back problems, we are not as readily to be put, to sleep for surgery because of the health issues. I believe, and I may be mistaken, but I believe this egg stop procedure is very quick.
Yeah.
So that even as you age, even though that may be an issue, this can do a lot of benefit.
Right.
So it's worth, talking, because I talked with a lady the other day after Dr. Hayward was in, and she was asking about her mother, and she said, but she really doesn't need to go under an extensive surgery because of the risk. And that was one of the things he had covered, was that he can do some things that are very short in duration that can provide a lot of relief.
Well, let me turn my microphone back on. I just hope people that is having back problems and they've been to other doctors will get a second opinion with Dr. Frank Hayward. It's certainly something that I hope you'll do, because I'm afraid this guy is going to be growing so much in patient care that it's going to be hard to see him at some point. And he wouldn't appreciate me saying this, but we're going to be lucky to keep him here in Cape Girardeau, because somebody like that is Well, the bigger place is going to want him.
I think he's already had a few calls, but
He has.
he considers this home right now, so hopefully we can keep him here.